All right. So as I mentioned, there are 7 community medicine fellowship opportunities available in Northern California, each one with its own distinct area of focus. For the next academic year, 2023 and 2024, we have fellows already selected for the Napa Solano program, as well as Santa Clara will have its inaugural fellow in Christie. Congratulations, Christie. But we look forward to interviewing candidates for the remaining 5 positions for the next academic year. And I always like to review with the group our mission statement because I think that this really hits upon a lot of what the important features of the Community Medicine Fellowship and really what we are trying to accomplish. We are hopeful that by the end of this fellowship experience, that our fellows feel comfortable going into any setting, assessing what the needs and the resources and the assets are of that setting, and then partnering with community leaders and stakeholders to really achieve health and well-being for all in an equitable way, and thinking about particularly our populations that are marginalized and most vulnerable, and ensuring that they get the standard of care and the opportunities that other communities receive as well. And so this is not just about what we do within the clinical setting of treating patients one-on-one and providing direct medical care, but also how can we affect things like food insecurity? How can we use our standing in our communities and our relative privilege to advocate on behalf of our community members at the state level, at the national level? How can we partner to ensure that the education that our youth receive is robust and prepares them for an ever-challenging world? And so these are all of the things that we really try to incorporate within the Community Medicine Fellowship experience. The fellowship is roughly organized to be mostly community-based primary care, and depending on the background of our fellows and what they would like to include in the spectrum of care that they provide, whether they want to continue doing labor and delivery, doing minor procedures, predominantly adult medicine, a combination of peds and adult along the spectrum. We help to kind of customize that depending on the interest and the experiences that our fellows have had prior to beginning the fellowship. And then we are oftentimes able to customize it to make sure that they get their experience that they want either at the community-based clinics or at KP. And they have the opportunity of working in both settings, which is an opportunity to sort of compare and contrast and to learn from practicing in different settings and different approaches to patient care and population management. And I think that there is something to be said about the flexibility and adaptability of going sometimes in between 2 to 4 clinical sites in 1 week, of quickly being able to adapt to see, okay, how do I do the referrals in this setting? What do I have case management at this other setting? How is it that I connect somebody with community resources? What are sort of the challenges that maybe one population is facing versus another population? And that flexibility and adaptability is a life skill that benefits our fellows no matter what it is that they choose to do in the future. And then the rest of the time of the fellowship is really protected time for the fellows to do their longitudinal scholarly based work and project. And most of our fellows not only do this longitudinal project, but they end up signing up and getting involved in 3, 4 other projects along the way because they tend to be passionate in a lot of different areas. And so there is protected administrative time to be able to do that. We have didactics twice a month where the fellows regionally will get together and we'll cover a variety of topic areas in faculty development and clinical medicine and research and leadership skills, and an emphasis on diversity, equity, inclusion, and anti-racism, anti-oppression efforts, and how we can integrate that sort of social justice and equity lens in everything that we are doing as physician leaders in the community. And then the fellows have an opportunity to take part in the 2-week health policy elective that is available every October in Northern California, doing a deep dive in local, state, national, and global health policy topics and issues. Understanding that for Many in medicine, health policy is not part of our traditional training, and we are expected to work in an environment that many of us may not understand the complexities of, and we don't realize the ways in which we can try to affect change in those spheres that can have huge downstream implications for multitude of patients, if not communities. And so the health policy elective is an opportunity to learn about things like health economics and understand the history of healthcare in the US, of comparative global health systems and how other countries have arranged their health systems, and comparing and contrasting against what we're doing here in the US, of understanding things like transgender health policy and climate change policy, and the ability to sort of step back and really do a deep dive is always a really welcome opportunity to learn from incredible content experts in their fields who join us from throughout the nation. And so we're really excited to offer that opportunity to the fellows to apply for as well. And as I mentioned, the fellows have, an educational stipend that they can use for their own learning and attending conferences, but also we support the fellows anytime that they're going to be presenting their work at regional or national conferences. And there are a couple of conferences that, when they're available, we love for the fellows to attend, including the picture that you see on the pictures on the left-hand side of the screen are from the UCSF Colloquium, which is a great opportunity, very much a social, community-minded research that is presented at that colloquium every year, and a lot of the local residency programs and medical schools have representation at that conference. This is just a sampling of some of the didactic sessions that the fellows have an opportunity to take part in throughout their fellowship year. You'll see that there's a list there of sessions that are sort of built in, and then every spring, the fellows have an opportunity to decide on an area of focus that they would like to pursue in more detail. And so the fellows this year have selected leadership, as well as sort of community engagement and empowerment, and developing sort of those community-based skills. And so that's what we're going to be focusing on for the spring semester this year. And then I mentioned earlier the scholarly activity work that the fellows take part in for their year. This is just a sampling of some of the projects that previous fellows have done as part of their fellowship year. The picture in the middle on the left-hand side is from the Vallejo Mobile Unit, which has now grown. The graduate from our program, Emily Fisher, started this at the tail end of her residency, continued and really solidified it during her fellowship, and now as a faculty member has been able to continue this work, was able to work with Project Room Key during the COVID times and expand this work and include it as actually part of her responsibilities within Kaiser Permanente. And so it's been amazing to see the work that the fellows do also help to influence and change our organization, and really to demonstrate the innovative ways in which we can be doing great work out in the community. And then, as I mentioned, the other various educational opportunities, we are hopeful for our global health opportunities to return back, as they were on hold for the pandemic. But in the meantime, there are plenty of local, regional, and national opportunities and conferences for our fellows to take part in. And then we do have an official textbook that is really great for some of the day-to-day as a reference. And then we do a spring sort of book club where we choose one book to read as a group, and we have some time set aside to kind of do a deep dive. So last year and this year, the book chosen was Caste, and if anyone who's read Caste understands why that was chosen, it's an incredible book, an incredible opportunity to really discuss in depth some of the challenges historically and continuing today that we have in achieving health, equity, and justice for our community members. And this slide just highlights some of the work that our fellows are currently out in the community doing. I'm very fortunate to have personal relationships with our fellows, current and past, in addition to a professional relationship. And so I'm getting pictures of babies being born, but also updates about, professional endeavors. And one of our fellows, Katie O'Rourke, just let me know a few weeks ago that she has incorporated, she's now doing integrative medicine clinic with the residents at in the medical office building that she's working with, which is amazing because her fellowship, her concentration was in integrative medicine, and she did the 200-hour University of Arizona course. And so now she's able to actually incorporate that into the work that she's doing day to day. But our previous fellows are in leadership positions, are developing innovations in medical education as well as out in the community, and are doing a variety of work and are able to take the skills that they have gained in their fellowship experience and really apply them to multiple different areas and opportunities after their fellowships. And that takes us to the end of a very short slide deck, but hopefully it helps to provide some additional information about the Community Medicine Fellowship opportunity. I'm going to stop sharing my screen for a moment in case there are any questions that have come up, and I'm going to look at the chat because I did not have the chat available to me while I was presenting. Okay. Oh, great. So Naila was adding in some information about the specific Oakland opportunity and put her email there if anybody has questions about that. And then Hila has joined us as well. Thank you so much. And talking about the opportunity available in San Jose. So I will pause there. Are there any questions from the group about any of these opportunities, any things that we can clarify for you? We have representatives from a few different programs today who can also answer site-specific questions. I guess I was very clear in terms of the information that was provided. And I don't know if any of the other site directors or representatives from the sites want to add in any information if you're able to unmute. I know this is a time where people are transitioning, wrapping up clinic, heading home for the day, so it may not be possible. No questions from the group. Oh wait, something popped up in my chat over here. Okay, perfect. Thank you, Jennifer, for spreading the word. We very much appreciate it. We're always looking for great candidates. I think one of the challenges with this opportunity is that it may be a little bit more difficult to find than some of the other fellowship opportunities that are available after completing a primary care residency program. And so anytime that we can spread the word about this opportunity, we know that there are a ton of people out there who would be interested in taking part and of this being the next step in their professional journey. So appreciate you sharing that with your residents. All right. Well, if there aren't any questions, I will stay on for a little bit in case anybody else drops in or there are additional, if you think about a question, but I also want to respect everybody's time and their evenings and have a nice dinner and hang out with family and friends after a long day. But on behalf of the entire program of the KP Northern California Community Medicine Fellowship Program, Thank you so much for joining us this evening. Really appreciate your interest and appreciate your administration of the programs as well. And feel free to reach out anytime with any questions. We have recorded this, so we'll send that out, and feel free to share it widely with those who might be interested in this opportunity. Thank you, Liza. Have a good evening, everybody.